Welcome back to the chamber, and I call to order the interactive multi-stakeholder hearing as part of the preparatory process for the high-level meeting on the fight against tuberculosis. And I'm so glad to see so many people. It is very rare when I see this room so packed. It is indicating, on one hand, the importance of the issue, the second hand, your dedication. And thank you very much to all of you for coming over to New York and making your valuable contribution to this event. This meeting is held in accordance with Resolution 77/274 of 24th of February 2023. And I welcome you all once again on this meeting. This interactive hearing provides an opportunity for all relevant stakeholders to contribute to the ongoing preparatory process for the high-level meeting, with a focus on the current state of efforts and top needs to accelerate the TB response. Participants will be encouraged to exchange views on key priorities for the high-level meeting, while underscoring experiences and best practices on the ground, highlighting the special challenges faced by civil society and other relevant stakeholders working in the field, and the need for stronger accountability at all levels. The hearing is meant to contribute to the creation of a common knowledge base among member states and stakeholders that can inform science-driven decision-making by the General Assembly. Madam Deputy Secretary General, welcome on board. Dear Mr. Minister of Uzbekistan, thank you much for joining us. Excellencies, ladies and gentlemen, as just mentioned, we gather here today to address one of the most pressing challenges of our time, ending the tuberculosis epidemic. I commend the World Health Organization and the Stop TB Partnership for the support to my office in organizing this evening. Thank you very much indeed. I also want to acknowledge the work of governments, civil societies, academia, businesses, and financial partners. Thanks to your collective efforts, we have saved an estimated 74 million lives since 2000. The 2018 political declaration has established an ambitious time-bound goal to end the TB pandemic by 2030. Many of you here today contributed to this landmark agreement and the implementation of the commitments made. Thank you very much to all of you. Ladies and gentlemen, Robert Koch has discovered the bacteria of tuberculosis 141 years ago. Alexander Fleming has found the first version of antibiotics 95 years ago. And it has been shortly after the foundation of this very organization, the United Nations, that the mass vaccinations against TB have started. Since then, significant progress has been made in several areas, yet, despite our achievements, we are off track in our drive to reach the goals which were set in Agenda 2030 or in the 2018 declaration. TB is preventable and curable, yet it remains one of the world's cruelest infection diseases, the silent killer among us. The latest global TB report estimates that 1.6 million people died in 2021 alone, while close to 11 million fell sick with the disease. But the numbers don't tell the whole story. 1 in 2 people with TB and their households face catastrophic effects. We know that This epidemic thrives on inequity. Poverty and undernutrition are known drivers of TB, especially in conflict settings and climate disasters. Moreover, there is an unjust gap in access to health services that could prevent infection or treat the infected. In addition, stigma and discrimination further deepen vulnerability to TB and hinder the response to it. Advancing our action requires all specialists and decision makers to work together. To address the root causes of the TB epidemic, we need effective and robust prevention strategies. To end the pandemic, the epidemic, we need safe and efficient vaccines capable of preventing infections by the new strains of bacteria. I welcome the commitments and efforts to develop vaccines and antibiotics which are effective against the bacteria of today and tomorrow. We must also ensure that all individuals, regardless of their background, have access to the necessary prevention, diagnostics, and treatment options. Options that are worthy for the 21st century. As we prepare for the second high-level meeting to end TB, it is vital that we hear from the diverse range of stakeholders, including people and communities affected by the disease. Tomorrow we are going to listen to many survivors. Their experience will be very telling. Dear friends, your views and actions have been critical to advance the fight against TB. Your engagement and inputs today can be crucial in achieving our goals to have, after so many centuries, 0 victims to tuberculosis. I urge all member states to reflect on the ideas shared here to incorporate them into their thinking. We must not let this treacherous killer continue to devastate lives and communities. With science on our side and guided by equity and inclusivity, we have now the best chance ever to end tuberculosis epidemic. Let us not miss out on this chance. I thank you. I now invite the Deputy Secretary General of the United Nations, Her Excellency Amina Mohammed, to make a statement.
Thank you very much. President of the General Assembly, Shaba Kourosi, Excellencies, distinguished guests, many friends from civil society that I see in the room today. Ladies and gentlemen, it's incredibly heartwarming to welcome you all into the United Nations. I'd like to thank the President of the General Assembly for convening us here today on this really important occasion, but also to the Stop TB Partnership. Over the last decades, we've seen extraordinary progress by many governments and our partners in the fight against tuberculosis. As the President of the General Assembly has said, we have saved 74 million lives through our global response efforts since 2000. In research and innovation, we have 12 new diagnostic tests and safer, more effective and time-efficient treatment options. We've even broken through complex forms of drug-resistant tuberculosis as we strive to provide treatment for all. Yet despite such milestones, TB continues to be one of the biggest infectious disease killers in the world. Over 10.5 million people fell sick and an estimated 6.1 million died in 2021 alone, and it is now the leading cause of death for people with HIV. We meet at a deeply challenging moment for global health, following reversals and deteriorating trends. The last couple of years have been marked by epidemics colliding with pandemics, armed conflicts, economic crises, and climate disasters, all of which have an impact on health, along with food insecurity, poverty, and unequal access to services. Our fight against tuberculosis is not only about global health governance, it's also about sustainable development itself. The TB epidemic is driven by both health and social determinants, such as poverty, undernutrition, and HIV. The disease disproportionately affects the most vulnerable in all our countries. Our success against this preventable and curable disease depends on our ability to work across sectors and eliminate economic distress, vulnerability, marginalization, and stigma often faced by those affected with TB. This requires international stewardship and action across all the SDGs at the national level. Friends, in the face of this urgent need, the second UN high-level meeting on TB is a unique opportunity to fast-track progress and revitalize our promises. As presented in the report before you today, it is certainly the time to act. We urgently need to accelerate progress towards universal access to tuberculosis services in both high and low-burden countries. By 2027, all people with TB should have access to health and social benefits package so they do not have to endure financial hardship. 100% of people diagnosed with TB should have access to WHO-recommended rapid diagnostics and quality-assured treatment. For this, we need to invest in the global TB response with at least $22 billion. In addition, with $5 billion a year into TB research and innovation, we can develop safe and effective tuberculosis vaccines and simple one-stop shops for quality tests and care. This would be a game changer. This September, heads of state will meet at a defining moment for both health and the stocktake of the Sustainable Development Goals. At 3 separate high-level meetings on health, we will discuss universal health care, pandemic prevention and response, and how to overhaul our efforts on the TB epidemic. All of this is framed within the larger picture of the SDG Summit, our call to make sure that we deliver to the world's poorest and most vulnerable, while securing a safer, more sustainable and prosperous future for people and planet. Ladies and gentlemen, the high-level meeting on tuberculosis will be a critical opportunity to make some concrete gains. We need each and every member state to commit to adequate and sustainable finance for the TB response so that all have access to quality care. We need to invest in research and development so that medical countermeasures are affordable, accessible, and appropriate, including vaccines, tests, and medicines that can easily be deployed to low-resource settings. We need to eliminate stigma and discriminatory practices that in too many places contribute to barriers against equitable public health responses. This is what success will look like. This is how we leave no one behind. But we cannot do this top-down. It's clear that delivering on the SDGs requires building resilient communities from the bottom up. This means closely working with civil society, affected communities, and the private sector. It means strengthening public-private partnerships nationally and globally, and where necessary, creating new ones. It also means ensuring that health strategies address the many determinants of TB, including poverty and undernutrition. Uniting around tuberculosis response provides a critical opportunity for us to build health systems that are capable of not only preventing and treating TB, but also of protecting the broader health and well-being of entire communities. We have seen this in the action during the COVID-19 pandemic, with national TB programs and systems leveraging support to the COVID response, a great example of how we can build stronger pandemic preparedness systems. Progress on the TB crisis is progress on the SDGs. By averting TB-related financial hardship and preventing the development of the disease in vulnerable groups, we are helping to diminish inequities between communities. As we scale this up at the global level, we're helping to diminish inequities between countries. And this is why we're here. We're here to listen to one another. I see huge potential in listening to the voices of experts, our communities, and the survivors present in the room today. Tuberculosis survivors and affected communities need to be heard. They are our greatest allies in the fight to end the TB epidemic. Hearing these stories and learning from these lessons can help us to end TB. In my personal story, my father had TB and he passed it on to my 2-year-old sister. Cured, so we thought. 10 years later, it came back again to claim his life at the age of 50. but I do have today a 50-year-old survivor, my 2-year-old sister. There are lessons to learn from the diagnosis, from the treatment, and from the follow-up. And I hope that these lessons can help us to propel with urgency the success we need to see in ending TB. I hope that today's discussions can help us shape a united approach and form the foundation of our collective asks from world leaders at the multilateral level. The UN stands with you today and is committed to working with all partners to end tuberculosis once and for all. Let's make this happen together. Thank you.
I thank the Deputy Secretary General for her statement, and I keep fingers crossed for your aunt, if I'm not mistaken. Ladies and gentlemen, a couple of days ago, I had a conversation with the Director General of the World Health Organization, and as you may know, our plan was that he would come and address you in person. Unfortunately, unforeseeable conditions forced him to cancel some of his programs and travels, but he was very keen to share with you some of his ideas related to the work and supporting your work in the field fighting the TB. So now I invite you all to view the pre-recorded statement by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, to make a statement.
Chaba Kroshi, President of the General Assembly, Your Excellency Amrilo Aniatov Shodyovich, Minister of Health of Uzbekistan, Your Excellency Bakhtior Ibragimov, Permanent Representative of Uzbekistan to the UN, Your Excellency Shistov Ishterski, Permanent Representative of Poland to the UN, Excellencies, dear colleagues and friends, good morning, and I apologize that I cannot be with you in person. I thank Your Excellency, the President of the General Assembly, and Uzbekistan and Poland for hosting this important discussion as we prepare for the high-level meeting on TB. On Friday, I declared an end to COVID-19 as a global health emergency. It was a significant moment. For more than 3 years, COVID-19 has turned our world upside down. In addition to the millions of deaths caused by the virus itself, COVID-19 has severely disrupted health systems, depriving millions of essential health services, including for TB. Conflicts across Europe, Africa, and the Middle East have made life-saving services even harder to access for people living with TB. These challenges have been a setback in the fight against TB, reversing some of the significant gains we have made over the past 20 years in expanding access to prevention, testing, and treatment for more than 70 million people. This year's high-level meeting can and must be a turning point in reinvigorating progress in the fight against TB. We need to make the tools we have available to more people, but we also need new tools, including new TB vaccines. That's why WHO has proposed establishing a TB Vaccine Accelerator Council to facilitate the development, licensing, and use of new TB vaccines. We're asking leaders to commit to concrete targets over the next 5 years to see 90% of people with TB reached with treatment and preventive treatment, to see 100% of people with TB diagnosed with a WHO-recommended test, to see at least one new TB vaccine approved, to adequately fund the TB response and TB research and innovation, and to see all countries include TB services in benefit packages as part of their journey towards universal health coverage. Meeting these targets is crucial for saving lives. But it's clear that we cannot truly end TB unless we address its drivers: poverty, malnutrition, diabetes, HIV, tobacco and alcohol use, poor living and working conditions, stigma and discrimination through multi-sectoral action. As always, strong political leadership is vital. With support from WHO and the many other partners represented today, civil society and affected communities also play a key role, which is why WHO established the Civil Society Task Force on TB 5 years ago. The COVID-19 pandemic has demonstrated how we can come together to overcome global health threats. Our task is not easy. TB is an ancient and wily foe, but nor is our task impossible. Together, we can ensure political commitment is translated into concrete action and investment. Together, we can end TB. Thank you, and I look forward to seeing you all in New York in September.
I thank the Director General of the World Health Organization, and I also wish to acknowledge the presence of Dr. Jérôme Salomon, Assistant Director General, Universal Health Coverage, Communicable and Non-Communicable Diseases, with us today. I now invite His Excellency Inoyatov Amrilo Shodievich, Minister of Health of Uzbekistan, to make a statement.
Thank you. Good afternoon, ladies and gentlemen. Dear Mr. Csaba Kőrösi, President of the General Assembly, dear Mrs. Amina Muhammad, Deputy Secretary General, dear Dr. Tedros Ghebreyesus, Director General of the World Health Organization, dear Mr. Abifuna Augustin, Vice Chair of the Stop TB Partnership Board, and dear colleagues. It is an honor and privilege to address you on behalf of Uzbekistan, the co-facilitator of the intergovernmental negotiation process for the General Assembly high-level meeting on the fight against tuberculosis. I would like to commend the President of the General Assembly, World Health Organization, the Stop TB Partnership for convening this very important and timely multi-stakeholder hearing. We are glad to see here today broad range of stakeholders representing governments, parliaments, civil society, academia, medical associations, the private sector, people affected by tuberculosis, TB surveyors, international and regional organizations, and many others. This is a clear indication of the overall commitment to ensure the success of the upcoming high-level meeting. As we all know, the land of Maurun Nahr, or today's Uzbekistan, has served the world in world civilization since time immemorial: science, education, art, culture, trade, in addition to being the cradle of modern innovative medicine today. The contributions of our great ancestors Al-Kharazmi, Al-Farabi, Abu Rayhan Beruni, Mahmud Zamakhshari, Abu Nasr Farabi, who left an indelible mark and name in the world civilization, are incomparable. During the coronavirus pandemic, all humanity has once again witnessed that the instructions given by our great-grandfather Avicenna on identification and treatment of infectious disease 1,000 years ago have not lost their relevance today. As we embark on the active phase of the preparation process, we should combine all our efforts to thoroughly review the implementation of the previously agreed goals and targets, as well as to identify gaps and solutions that accelerate the progress towards ending the global epidemic. The first ever high-level meeting of the General Assembly on tuberculosis, held in 2018, generated strong momentum for eliminating TB and catalyzed robust prevention, diagnosis, treatment, and care at all levels. Despite the gains achieved in the tuberculosis response, including millions of lives saved, the world is lagging behind in its commitment to the most time-bound targets set out in the 2018 Political Declaration on Tuberculosis. The tuberculosis remains an acute global health and development challenge requiring urgent multi-sectoral action. We should step up our efforts in order to prevent further spread of TB and save lives by ensuring equitable and affordable access to high-quality World Health Organization recommended effective diagnosis, treatment, and care free of stigma and discrimination. It is necessary to promote adequate and sustained investment for the TB response and for innovation, particularly to develop safe and effective vaccines. Uzbekistan, as the co-facilitator of the preparation process, stands ready to work together with all stakeholders to accelerate global collective actions towards ending global epidemic. As an evidence of our strong commitment to eliminating TB, let me briefly inform you about our national efforts in fighting against this disease. Because gains reached at the national level would be important building blocks for the eradication of TB at the regional and global levels. The fight against TB in Uzbekistan has been elevated to the highest level of state policy in recent years. President of Uzbekistan, His Excellency Shavkat Mirziyoyev, pays special attention to transforming tuberculosis service in line with international standards. Today, a 5-level modern laboratory system consisting of city, inter-district, regional and central reference laboratories is operating in the country for early detections of tuberculosis disease. There are of government funds allocated to purchase anti-tuberculosis drugs are doubling every year. As a result of reforms, almost 130,000 people's lives were saved. The incidence of tuberculosis decreased by 43% and the mortality rate by 18.4%. In January this year, a special presidential decree was adopted in order to further develop pediatrics and pulmonology service for 2023-2026. According to this decision, starting from January 1st, 2023, annually 1 million people will be screened for the latent type of TB, 21,000 people infected with TB, 18,000 people with active TB disease will be covered with high-quality treatment every year. Mobile brigades of lung health with qualified specialists are established in all 14 administrative regions of Uzbekistan in order to provide free medical screening for residents of remote areas, leaving no one behind. Dear participants, we strongly believe that together we can end TB in the world. For that, we have every instrument, knowledge, and resources. Let's unite around this noble goal, inspire hope and encourage leadership. In conclusion, I would like to express my gratitude for your participation in this multi-stakeholder hearing. We look forward to candid and productive discussions throughout the event. Thank you for your attention.
I thank the Minister of Uzbekistan for his statement. And now I invite Mr. Austin Obiefuna, Vice Chair of Stop TV Partnership Board, to make a statement. Sir, the floor is yours.
Thank you, Your Excellency. The President of the General Assembly, the Directors, the Deputy Secretary General, DG Tedros, Honorable Ministers, Your Excellencies, stakeholders, CSOs, and communities. It is my honor to address you today as the Vice Chair of the Stop TB Partnership at this hearing that is essential to the development of the first draft of the political declaration, the outcome document of the upcoming UHLM on TB. And here in my hand are the UHLM key asks from the TB stakeholders. Excellency, you can have a copy. If you wonder what the global TB community expects to see in the political declaration, this is the answer. Distinguished representatives of member states, if you adopt this, we can all go home. Everything is here in this document. There are six key asks. And to emphasize how important they are, I will spend a minute of my time to read them out. Key ask number 1, reach all people affected by TB with prevention, diagnosis, treatment, and care by implementing evidence-based quality interventions and tools as per the latest international guidelines. 2, ensure all national TB response are equitable, inclusive, gender-sensitive, right-based, and people-centered. 3, accelerate the research, development, rollout, and access to new TB vaccines, diagnostics, drugs, and other essential new tools, including digital health technology, geared to the needs of most neglected, key and vulnerable populations. 4, invest the funds necessary to end TB. 5, prioritize TB across systems for health, universal health coverage, primary health care, pandemic prevention, preparedness and response, and antimicrobial resistance. 6, ensure decisive and accountable global, regional, national leadership, including regular UN reporting and review. Each of the asks is supported by specific commitments and targets. For example, under key ask 6, the one on accountable leadership, there are 9 commitments for the global, regional, and national accountability. Your Excellency, now let me emphasize that true accountability can only come from outside. You cannot be your own auditor. And nobody is better placed to ensure accountability than civil society and those personally affected by the disease. This brings me to this document, the Daily Divide, the accountability report of the TB-affected communities and civil society, priorities to close the Daily Divide, which I am now honored to officially launch right here and right now. Over 1,000 partners from TB-affected communities and civil society organizations from 92 countries engaged in the development of this report, which brings TB realities on the ground to the forefront. It highlights the powerful solutions and coping strategies, and its calls to action reflects the vision on what it takes to end TB by 2030. And it's in full alignment as well with the key ask. The report, like the key ask, calls the commitment of multi-sectoral action, decisive leadership, and accountability, and demands, among others, the need to apply community-led monitoring models. Just a few days ago, the WHO announced that after 3 years and 4 months, COVID-19 is no longer a public health emergency of international concern. Let me remind you that TB has kept the title of global health emergency since 1993. In this key ask is the pathway to ripping TB off that title. Our today's panelists will give context for the key ask and provide distinguished representatives of the member states with what is needed to ensure a strong political declaration. Your Excellency, when developing it, please think about 1.5 million human lives lost every year due to TB, and you heard the Deputy Secretary General made that comment as well. Think about 1.1 million children and young adolescents who fall ill with TB every year, and more than 225,000 of them die. Our progress so far is impressive, I must say, but not sufficient. That is why it is so important that every and each one of us in this room today agree that we cannot let TB to win and continue as an airborne pandemic. We need to ensure that political declaration sets the bar high and that we are ready to go far and beyond to turn the commitments into action. Yes, we can end TB. Thank you.
I thank the Vice Chair of Stop TB Partnership Board, and I particularly thank him for walking the talk. Now we can feel in this chamber that our room is being filled by promise, energy, determination, and will. That is what we need to carry on. Transformation has started. Thank you very much indeed. As indicated in the program, this interactive multi-stakeholder hearing also consists of 2 panel discussions and a closing segment. The first panel discussion, entitled Fast-Tracking Multi-Sectoral and Multi-Stakeholder Action to Ensure Universal Access to Equitable, High-Quality, People-Centered TB Services, will be moderated by Ms. Thokozile Firi, TB HIV activist, Chief Executive Officer of Facilitators of Community Transformation, and will take place immediately following this opening segment. The second panel discussion, entitled Mobilizing Adequate and Sustainable Financing to Ramp Up the TB response and Advance Research in Innovation, will be moderated by Mr. Harry Hausler, Chief Executive Officer of the TB HIV Care, and will take place from 4:30 p.m. to 5:45 p.m. The closing segment will take place immediately thereafter. Thus, the opening segment now is concluded, and I would like to ask the moderator of the first panel discussion to take the podium.
We will now begin the panel discussion, one entitled Fast Tracking Multi-Stakeholder Action to Ensure Universal Access to Equitable, High-Quality, People-Centered TB Services, is now called to order. The President of the General Assembly, the Director General of World Health Organization, Your Excellencies, dignitaries, distinguished delegates. I am Tokozile Pili Nkoma from Malawi. I'm an executive director of an organization called FACT. I am also a co-founder of TB Women Global and also a previous board member of the Stop TB Partnership. This afternoon, I'll be moderating this session, and before I move forward, allow me to introduce to you our panelists today. The first to speak is Ms. Paran Salamita. She's a TB survivor twice and a peer educator that empowers ex-TB patients to become treatment supporters for those who are still on treatment and as part of MDR-TB patient organization PETA from Jakarta. She's currently a member of GCTA. And our first panelist as well will be Ms. Tina L. Campbell. She's a registered nurse, and she's a Cree woman, an advisor for the Northern Intertribal Health Authority, which serves 33 on-reserve communities in North Saskatchewan. We'll also have Professor Ibrahim Abubakar, who is the Dean and the Faculty of Population Health Sciences, University College of London. He is also the chair of the Lancet Migration Commission, former chair of WHO Strategic and Technical Advisory Group for Tuberculosis, and member of the Global Preparedness Monitoring Board. We'll also have Mr. Shamron, who is a champion from Cambodia. He's the executive director of CANA, where he has helped pioneer TB community-led monitoring and formation of National TB Survivor Network, TB People Cambodia. He's also the co-chair of the Activist Coalition on TB in Asia Pacific, ACT Asia, and he is part of both the WHO Civil Society Task Force and Developing Country NGO delegation to the Stop TB Partnership Board. Before giving the floor to our panelists, I would like to inform participants that those who wish to speak during the interactive discussion are kindly requested to press the button located at the base of the microphone in order to be placed on the list of speakers, and fill out the white square paper on your desk with your full name and organization. Kindly note that representatives of the Secretariat will walk around the room to collect the white papers of those wishing to speak. Those seated in the gallery without access to the microphone should approach the attendant in their section. After your name has been called, please deactivate your microphone. Participants may indicate their wish to speak starting now. They will be called to speak after the presentations by the panelists once the floor is opened for the interactive discussion. At this point, I invite Paran Salamita to share her powerful story.
Greetings to all of you. My thanks to all dignitaries and organizers of this important hearing. I'm here today as a multi-drug resistant TB survivor to share with all of you in here my story, to inspiring you to commit to making the global TB response people-centered. It's all about people like me. I was diagnosed by TB in 2008, and it was a long 7 years battle for survival. I spent my life fighting TB due to lack of information in my community, inappropriate diagnosis, and inadequately prescribed medicine at the private healthcare facility. My family and I, for 2 years, thinking that I was getting cured, but we were wrong. I spent when my symptoms are back and I'm coughing up blood, I was living in fear because I have to stop working and my saving was running out. I finally accessed a primary healthcare center when I knew the services, they are free. I got referred to get checked with a molecular diagnostic tools, and finally was diagnosed with MDR-TB. I had 15 tablets and an injection every day at the best TB referral hospital in the country, but I had to pay for 2 hours trip every day. I was transferred back to the primary health care center. Unfortunately, during my treatment there, I was pressured to move out of my own home because I lived next into a kindergarten. Regardless of the hurtful stigma, I really could not imagine moving away from my family to be in isolation. My mother not only had to care of me, she had to work as a maid for another household to provide additional income for my family, nutrition, food, and supplement during my treatment. After 19 months and 28 days, I was cured from MDR-TB. My experience of living with TB did not affect me physical, but also psychological, and this impact lingers on until today. That experience robbed my productive years as a woman. Therefore, even when I was grateful being healthy, I continued to fear that I would not be able to get a job because of my health record. Fortunately, I could find a new purpose when I joined a MDR-TB peer support organization or Pejuang Tangguh PETA in Jakarta, which enabling me to provide peer support to persons with TB, network with regional and global organizations working to end TB. I'm also proud to be a member of the WHO Civil Society Task Force and then WHO 1+1 initiative to end TB, Youth Initiative to End TB. Ladies and gentlemen, today the reality is unacceptable. One person dies every 3 minutes from this curable and preventable infectious disease. We have to fast-track effort to end tuberculosis by 2030. The WHO DG flagship initiative to end TB has bold strategies. To achieve and implement these strategies, we all need to start with listening to the people that are affected by TB. Importantly, I would like to remind to all of you, health is a fundamental right. No one should deny this. And my story is a story of a million across the globe. I urge you today, having heard me, that you will commit to make sure that the suffering from a curable disease is stopped, and persons with TB will have access to the best quality diagnosis, prevention, treatment, and care. I hope we can really listen to each other now, especially people affected by TB, in this hearing. May this moment be a catalyst that will accelerate the change that we need. Let's make sure that this is the final decade for TB. Thank you for listening me, and terima kasih.
Thank you so much, Paran, for sharing your powerful story. And indeed, what you have shared with us this afternoon brings the whole reason why this event is very critical today. I now give the floor to Ms. Tina Campbell. Tina, you understand well the challenges and barriers faced by indigenous peoples and other vulnerable populations. What do you see as essential actions to ensure no one is left behind in accessing TB prevention and care services?
Hello. It is an honor to be here to share my experience as an Indigenous person in Canada that has been affected by tuberculosis. The Canadian Constitution recognizes 3 groups of Indigenous peoples: First Nations, Inuit, and Métis. The current rate of TB for non-Indigenous people born in Canada is 0.4 per 100,000 people. Meanwhile, Inuit and First Nations people living on reserve experience rates that are 300 and 40 times higher respectively. Indigenous people make up only 5% of Canada's total population but experience the highest rates of TB disease and mortality. We are disproportionately affected by TB due to ongoing impacts of colonization and various health inequities experienced as a consequence. Decades of systemic discrimination and segregation with institutions such as TB Sanatorium have deprived Indigenous communities of the cultural, social, and economic tools needed to advance TB elimination. TB disease is the biological manifestation of unmet socio-ecological needs. Remote and isolated communities face inadequate housing conditions. Transmission risk also increases when exposure happens in poorly ventilated and overcrowded living conditions. Nutritious food and access to safe drinking water are either too costly or unavailable, affecting the health of individuals. Many communities are under-resourced to handle healthcare demands, and scarce access to timely care and services are barriers to TB elimination. Vulnerable communities around the world will recognize these social determinants and systemic injustices because this is an experience shared by Indigenous people all around the world and other marginalized populations, including minors, people in prison, migrants and refugees, people who use drugs, or people who experience homelessness. Like others who grew up in Canada, I was not aware that TB was still around. I was 23 years old when I was diagnosed with latent TB infection during an occupational health screen. I had no idea where I could have been exposed and knew very little about TB. As I explored more, I started to learn why TB was hardly talked about and how TB was tied so closely to my own family history. My kukum, or grandmother, was sent to Fort Capel Sanatorium twice in the 1950s. Here, the adults and children were separated and forbidden to interact. My aunt, who was under the age of 10, was sent to the same sanatorium during the same time as my kukum. Experiences of abuse, force feeding, experimentation, and isolation were shared with me. When doctors visited communities, those with TB were not permitted to collect belongings or say goodbye to family, and some were never seen again. For Indigenous peoples, this generational grief is still present. Mistrust and negative feelings of healthcare and institutions are a result. It was following my diagnosis with latent TB that I was offered a position at a TB clinic. Throughout these last 13 years, I've seen firsthand the impact the disease and its history has on my communities. Stigma and neglect impact my daily work. Imagine trying to relay those to those in remote and isolated communities, the urgency of TB screening, detection, and treatment, while they can wait weeks or months for services. In the year 2021, during a global pandemic with most resources and TB staff allocated towards COVID-19, I found myself in the center of coordinating response teams for TB outbreaks within on-reserve First Nations communities. At the height of the pandemic, people with respiratory symptoms were tested for COVID and not TB. As a result, people presented to health centers or emergency rooms at advanced stages of disease and were highly infectious. Clients were waiting a minimum of 3 weeks before they could complete an X-ray, and on average 100 days before receiving any tests for evidence of TB exposure. Today, there are 3 active TB outbreaks in my region, and the rate of TB has increased by nearly 300% between 2019 and 2022. As a TB care provider working with vulnerable populations with limited resources, I know how devastating just one diagnosis of active TB can be. In 2022, we had 72 diagnoses in my region. On top of that, half of those were under the age of 19. Do we not value these lives of these children? Additionally, from these cases, we identified over 1,600 people that needed screening or follow-up, which was completed by a nursing team of 4. We need help. Canada and governments around the world must stop the neglect that leaves so many people, including my people, behind. Urgent action must be taken to capitalize on the innovations and systems put in place to respond to the pandemic to prevent, diagnose, and treat TB, to leave no one behind. All national TB responses must be equitable, inclusive, gender-sensitive, rights-based, and people-centered. By committing to costed community rights and gender action plans, we can make this a reality. Thank you.
Thank you so much, Tina, for your speech and your submission, indeed for reminding us that indeed we can make this a reality. I now give the floor to Professor Ibrahim Abubakar. As a renowned scientist, academician, and global health expert, could you please share your perspectives on how we can boost the TB response through multi-sectoral action linked to pandemic preparedness and response, building on lessons learned from the COVID-19 pandemic? I now give you the floor.
Thank you. Thank you very much. So we've heard of the avoidable deaths and the untold suffering that TB causes and the numerous personal stories. Indeed, I will say that I cannot think of a greater tractable threat where we fail to effectively tackle as a species. Yet, why is the outrage? Why are we not more angry, and why are we not acting in the same way we acted with the COVID-19 pandemic? TB is a major tragedy of our times, sadly invisible to many. But there is hope. There is hope that if we work collectively across sectors and across stakeholders to change the narrative, to change the lived experience of millions of people globally, we can make progress. To do so, we need to work together across the three interrelated areas of multisectoral action that I will articulate. The first, for me, is health equity. The COVID-19 pandemic has exerted the greatest toll on the people who have the least ability to bear its burden. Indeed, they've had the worst outcomes, and they've also had worst economic and social impact due to the policy responses from COVID-19. Similarly, while we know that TB can affect any one of us, it disproportionately affects the most vulnerable. Here, it seems to me, is the key to the lack of outrage. For too many of us, TB is something that simply happens to other people, either people who are invisible to us because they are in faraway countries, or people who are invisible to us in our neighborhoods because they are marginalized, poor, and or simply just not like us. We have much to learn from the COVID pandemic. There's strong evidence that global control and elimination efforts for TB are being adversely affected, and the impact has been felt in an inequitable manner between countries, between rich and poor, between neighborhoods, between world regions, and among those with specific vulnerabilities, such as migrants. However, the pandemic has also enlightened us that it is possible for humanity, it's possible for society to respond at scale, to rapidly evaluate vaccines, to rapidly evaluate diagnostics and treatments. It is truly amazing to reflect on what can be achieved when the scientific community, policymakers, and heads of states pull together to act. As societies rebuild, we need to reinvigorate the TB response in a way that puts the needs of the most vulnerable at the very top of the agenda, and we must address the social determinants of health. Second, I'm excited by the unprecedented attention that many health priorities are going to receive here and in September. TB, PPPR, and UHC, all really important areas where if we work together, there could be multiple synergies and clear wins for global health and national economies. TB is a global emergency, but many of those who need care are denied universal health coverage or have barriers. No one goes to a health practitioner with a self-diagnosed TB, so only true access to UHC can ensure good TB care. Nevertheless, UHC must include specific tools, novel vaccines, and diagnostics for TB, with a very clear commitment to find cases early and to ensure that they get the shortest possible effective treatment. There are many altruistic reasons why we should work to eliminate TB. However, I believe there is also an important health security imperative that our world leaders must recognize. Preventing pandemics and TB is simply a lightened self-interest. I therefore call on the immediate prioritization of equitable access to care as a cross-cutting theme across all the three conversations that would happen over the next day or so. Indeed, I think we need to close the know-how, do-how gap, as my colleague Dr. Madhukar Pai would say. How do we do this? I would agree with my colleague that we need to get together and implement the WHO Director General's flagship initiative on TB and fast-track the process towards ending TB and achieving universal health coverage by 2030. Finally, I would say that we will not eliminate TB unless there is sufficient funding and independent accountability at all levels. We will measure success by using data and metrics synthesized by the Global TB Program at the WHO, and we shall ask our leaders to agree to be accountable on a global stage, judged by a trio of equal partners, TB survivors, civil society, and the jury of their peers. Thank you.
Thank you so much, Professor Ibrahim Abubakar. Now I give the floor to our last panelist and speaker, Mr. Shob Shamron. As a community and civil society leader, please share your vision and key strategies to ensure meaningful and active engagement and capacity building of civil society to fast-track the TB response. You have the floor, sir.
Thank you, Madam Chair, Excellency, expert, fellow health, advocate, and activist. It is my privilege to speak here for many civil society organizations around the world, particularly those from within the Asia and Pacific region, including my own country, Cambodia, which have all been tackling the ancient disease tuberculosis. Many of us, over 1,000 organizations from 92 countries, have come together and articulate our 6 call to action in the accountability report of TB-affected community and civil society, priority to close the deadly divide. In addition, more than 80 civil society and affected community-led organization representatives have also gathered in Jakarta, Indonesia, in March 2023 to come up a collective set of priorities, some of which are detailed below. Civil society organizations and TB-affected community can play a more important role by partnering with the government in tackling TB if they are empowered, involved, engaged, and funded. The joint statement of WHO Director General and Civil Society Task Force on TB, together with the social listening and community feedback of the community affected by TB, emphasize also the importance of meaningful engagement of the affected community. Community are not just service providers, but rather are involved in advocacy, law and policy reform, monitoring, and demand generation. For many, once capacitated and funded, see their work go beyond strengthening community system to ensuring pandemic prevention, preparedness, and response. To effectively combat tuberculosis, every country needs to have TB community right and gender action plan. We also need TB community-led monitoring, where users of services provide real-time data on any challenges, and community are the community first responder to help overcome them. Sharing an example of community-led monitoring where I come from, peer support group leaders who themselves have experience living with TB have been recruited and trained in using the One Impact monitoring tool, where they record and report any challenges and obstacles to accessing TB care services run by healthcare providers in their locality. The record and report help improve communication and understanding between TB service recipient, healthcare provider, and local policymaker, which can then integrate TB service, increase TB service uptake. Through this piece of work, peer support group leaders have become united to make their voice stronger than ever and have established their own national network of people living with and experiencing TB, which is now known, registered, and recognized as TB People Cambodia, to the extent that one of the executive committee members has secured a seat on the Global Fund Country Coordination Committee, the only platform overseeing the Global Fund grant for 3 diseases, HIV, tuberculosis, and malaria. Representation from TB-affected community on body like this and involving and funding the community in TB response is really important if we want to end tuberculosis. The positive change I have discussed are a result of the will of community on the ground with support received from Challenge Facility for Civil Society, I know this story is not exclusive to Cambodia, with community partners in other countries sharing similar experiences. I would like to thank USAID and France for being donor. I call on the Global Fund to continue scaling up its support of TB community. And I also appeal to other countries to involve in the mechanism that support and strengthen community. If we want to end TB, it is imperative that we close the financial gap for TB-affected community and civil society, and empower TB community to close the deadly divide and end the TB pandemic. Thank you for your attention.
Thank you so much, Mr. Shamron. At this point, we would like to give an opportunity to speakers to make your intervention. I now open the floor for comments and questions and a few guidelines for the same. Once I give the floor to a participant, I would request the speakers to press the microphone button at that point. The green light on your microphone will guide the technician to activate your microphone, and once the light on your microphone turns red, indicating that your microphone has been activated, you may proceed to make your intervention. In order to allow a maximum of all people who would like to speak, I appeal to all participants to limit your interventions to 2 minutes. And the timer has been installed on the screen to assist speakers with the time management. At this point, let me call for the first intervention from Medicines Sans Frontiers. You can press the button and speak. You can speak now. Thank you.
So they're calling out from there. Yes.
Could you make her again? She's right there. The microphone has a problem.
The name is called.
I think you can stand.
Okay, I think I want to make an intervention. I want to thank the speakers for their presentation and the good work. But I think I have 2 areas that I'll take 1 minute. So my first intervention is that we have talked about civil society and the affected communities. But I think at least civil society are at a very good and advanced level in terms of their implementation and the work around this. I think what is lacking mainly is to support the affected communities, build some movements around the affected communities at different levels, at the national, local, and even international level, so that they are able to have a movement that can be a platform for them to advocate and also to influence some changes that will positively impact and affect the TB response. Then this will also come with the issues around how do we also organize the affected communities in a way that they can advocate for domestic financing. I think it's our key ask. Most of the time we have depended a lot on the external resources. So how do we get back to our countries, our local context, and also influence resources allocations towards TB work, because that is something that has also been lacking for a while. And my last comment, and which is also a bit shocking that we need to pick all of us, that TB is among the oldest diseases. But currently, as we are, I think we have only one vaccine, and also the one for children. So we need to go back and ask ourselves, and I like challenging ourselves that HIV came about recently, but we can diagnose HIV even at the local, the lowest level, using rapid kits. COVID also came, and we all did it. So it's a challenge to all of us. And it's something that needs to get us a bit annoyed and get out of here and get hold of those who are doing research and ask ourselves, how come TB has taken the longest for us to reach there? So it's something that we need to advocate for and rally all our supports toward that.
Thank you. Thank you so much. Thank you so much for your intervention, and we'll invite a representative of We Are TB to make your intervention. And just also to remind that when you want to make the intervention, just press the mic once, and then the light will turn to red. You can just wait for it.
Aha, okay, great. Thank you, everyone. My name is Kate O'Brien from We Are TB and the National Tuberculosis Controllers Association. I'm also representing the TB Roundtable. I had tuberculosis when I was pregnant, and I nearly lost my life and my child. Today, my heart is with mothers everywhere who are left out of TB advancements, both during their pregnancy, with very little data on TB meds in pregnant and lactating people, and with TB treatments and diagnostics for children, so far behind what exists for adults. As an American, I'm very proud of the investments we've made in tuberculosis, but we can still do more. I want the United States to give big financially and to encourage countries with high burdens of TB to come forward with bold national action plans at the high-level meeting. And I want us to support those country plans. I challenge other donor countries to do the same, to match the resources with the actual need. I want us to act like the world leaders countries like mine want to pretend and say that we are. We need a TB vaccine. There's 5 right now that are in phase 3 clinical trials. We need an affordable point-of-care diagnostic. We need the creation, equitable access, and the uptake of these shorter regimens, and social support for people in treatment. We need these things for all people, even pregnant people and children who are still people. We're uniquely vulnerable, and they're always the last to benefit from scientific progress. It's not fair. We can't forget that tuberculosis is everywhere, even in this city, even in New York City. In the US, we're facing drug shortages, and TB programs are really suffering. We won't be able to take advantage of the shorter regimens if we don't have the medications. We can't use the global drug facility to get the medications. I was born in this city, I love it, and I want it to be safe. Thank you for visiting my city today.
Thank you so much for your intervention. I now call upon Honorable Ricardo Baptista, Unite Parliamentarians Network for Global Health, to take the floor.
Thank you, Madam Chair. I am speaking on behalf of the Unite Parliamentarians Network for Global Health, and it is quite incredible to see that the second leading infectious killer after COVID-19, which is tuberculosis, even above HIV and AIDS, continues to need us to be here today and to be here in September, but we must. And we know that universal health coverage and primary health care will play a very important role, but we need to address the issue that we are pushing for a health system model that is broken, that is pushing for more disease, as we've seen around the world. Health systems are leading to more disease, to the rise of the burden of disease, and to the rise of costs. We need to change that using digital tools and making sure that we are working with NGOs, with patient advocates, to make sure that everyone is included, that no one is left behind, particularly those living in most vulnerable situations, which is the case with tuberculosis. Innovation is critical. COVID-19 brought tremendous innovation, but as was mentioned here today, TB continues to be burdened with a century-old vaccine. And we have no doubt that that speaks a lot about the human nature of what we are discussing here today. If TB had hit mostly the richer countries of the world, we would probably have a modern vaccine working today. So we must make sure that we address this issue, because if we do not, the richer countries and the poorer countries will all be hit the same. As we've seen, more than 10 million people falling ill each year to tuberculosis. And when we look at the draft 0 of the pandemic accord, TB is not mentioned once. The final version must include tuberculosis. And to end, Madam Chair, in every crisis, Every time we lower our guard, tuberculosis always comes back with a vengeance. And I saw this in firsthand as a medical volunteer in Ukraine last summer. If we do not take action, we will never end TB as a global health threat. It is now in our hands. It's time to get the job done. It's time to unite. Thank you very much.
Thank you so much. I now recognize Ezio Tavaro dos Santos from Red TB Brazilian TB Research Network. You have the floor.
This statement results from civil society recent consultations in the Americas with support by PAHO. Despite America's growing inequalities and poverty, the region is lacking support from international cooperation agencies. We demand prioritization within the framework of human rights, gender perspective, and cultural relevance, with special attention to the most vulnerable populations. Without universal access and comprehensive social protection measures and urgent uptake of multi-sectoral approaches, the threat we do not reach the end-TB targets is very real. Although progress was observed within some countries, civil society is still perceived with reserves and suspicion, which limits the ability of communities to participate meaningfully in the TB policies and services. We demand countries to comply with commitments to open dialogue and collaboration with civil society in the benefit of all and good use of public funds. Civil society in our region continues to be underfunded and underevaluated. We demand access to consistent funding mechanisms to strengthen civil society organizations and support their representatives who act as community health agencies, technicians, and community specialists. TB research and development lacks participation of communities from conception to implementation. We demand governments to rapidly update their guidelines and implement international recommendations for TB prevention and care, and remove administrative barriers to import and intellectual property to ensure access to new technologies. Finally, we urge the UN to name a special rapporteur for the elimination of discrimination against persons affected by tuberculosis. Thank you very much, Madam Chair.
Thank you so much. I now invite Tara Noel from Medicines Sans Frontiers. You have the floor.
All right. Thank you, Madam Moderator and esteemed colleagues. I represent Médecins Sans Frontières, a leading TB actor running over 60 projects in 41 countries around the world. And as the largest non-governmental service provider globally, we treated almost 20,000 patients last year alone, including thousands for drug-resistant TB. We are also a leader in TB innovation, and we applaud the recent attention for preventative tools for the future, such as vaccination. However, we continue to witness the deadly gaps in diagnosis and treatment that affect patients today and need to be addressed. From this perspective, I'm going to focus on two recommendations we'd like to see highlighted in this process. And in fact, they're low-hanging fruit, are seemingly obvious, and would have an immediate impact, but still lack the necessary commitment and mobilization. First, we ask for urgent adoption and implementation of the updated WHO recommendations around shortened TB treatment regimens, which make TB treatment more accessible, significantly reduce the suffering for patients, and can reduce the stigmatization of and financial burden on patients and their families. The implementation of the shortened regimens is not just more humane, but may contribute to the reduction of global TB incidence. Member states are encouraged to immediately update their national treatment guidelines, commit to eliminating the barriers preventing progress, and begin implementing shortened TB treatment regimens without delay. Secondly, we ask member states to immediately adopt and implement the latest WHO recommendations for diagnosing and treating TB amongst children to ensure they do not continue to be excluded from global efforts and to reduce the unnecessary deaths among pediatric patients. It's estimated that more than 60% of all children with TB worldwide go undiagnosed, and 96% of children who die from TB were never put on treatment in the first place. A more considered effort should be made to use the already available diagnostic tools and child-friendly drug formulations as part of a safer and more effective regimen for children. Member states should also take steps to reduce the price of existing diagnostic tools and support the research and development of new and improved child-friendly TB tools. Thank you, Madam Moderator.
Thank you so much. I now give the floor to Yulia Kalancha for TB Europe Coalition. You have the floor. And just to remind that we should only take 2 minutes so that we have a lot of people to contribute. Thank you.
Thank you so much, dear participants. I'm from Ukraine and represent the TB Europe Coalition, a civil society organization united Europe and Central Asia. Today, thousands of people stand behind us, hoping that all the stories we hear about negative experience with access to care, treatment, and its consequences will not be repeated. And in order for such stories, like we heard from TB survivors, which break lives and families, not to be repeated, governments should be accountable for their promises they make for their people. We don't want another fancy document, but a document that will hold countries committed and accountable. Accountability is not only part of a control mechanism, but is also a mechanism for bringing different sectors to collaborate together. And therefore, we ask for strong political declaration points that ensure national accountability, which are linked to a key asks and to key ask 6 and include translation of UNHLM global targets and commitments into a national level targets adopted by country within the national frameworks and legislation. Multi-sectoral collaboration and accountability mechanisms should be implemented at countries aligned with One Health approach, together with annual country reporting and cross-sectoral high-level periodic reviews of achieved progress. We all know that TB is to a great extent driven by social determinants of health. In challenging environments, such as war in Ukraine, all social and economic factors that contribute to the development and spread of TB become even more acute. Equitable access to healthcare services is important for TB prevention and successful treatment, and this cannot be achieved solely by the efforts of the healthcare system. We really need political will. High-level commitment and sufficient funding are necessary to mobilize the work of different sectors at different levels. Last but not the least, civil society and communities should be meaningfully engaged in TB response, fully funded and recognized as equal partners in decision-making, implementation, monitoring, and reporting. Thank you.
Thank you so much. I now have 7 interventions in the order of Argentina. Blessy Kumar from Global Coalition of TB Advocates, James Cesar from United for Global Mental Health, the United Republic of Tanzania, Juliana Soares from FHI 360, and intervention from India. And after the interventions come through, we'll give an opportunity to the panelists, at least 1 minute each, to finalize. So we will recognize Argentina. Over to you.
Thank you. This is the statement from the Civil Society Task Force of World Health Organization, taken from the joint statement of WHO Director General and the Civil Society Task Force. The situation of over 4,000 people in the world losing their lives to TB each day, and close to 30,000 people falling ill from TB, which is preventable and curable, is unacceptable. We need to fundamentally transform the global TB response, drawing on lessons from the response to COVID-19 pandemic, and put an end to human suffering and death caused by this ancient global TB epidemic. This second UN high-level...
Thank you so much. I am reminded that we recognize Argentina, so you come after Argentina. Thank you.
Muchas gracias, señora moderadora. La Argentina celebra la participación activa de las organizaciones no gubernamentales, asociaciones médicas, sector académico y otras partes en esta audiencia. Consideramos que su experiencia es sumamente valiosa para abordar en todas sus dimensiones la lucha contra la tuberculosis. En este sentido, en 2022 se conformó en la Argentina la red de la sociedad civil Observa TV Argentina en el marco de Engage TV y de la Ley 27.675 de respuesta integral e intersectorial a la infección por el virus de inmunodeficiencia humana, las hepatitis virales y otras infecciones de transmisión sexual y la tuberculosis. Para la Argentina es fundamental favorecer el acceso a la salud con calidad y con equidad, garantizar una respuesta eficaz y efectiva, asegurando el acceso de todas las personas al sistema de salud e implementando políticas específicas para poblaciones claves en situación de vulnerabilidad y de menor acceso a fin de reducir situaciones estigmatizantes y discriminatorias en la sociedad. Por ello, consideramos que garantizar el acceso equitativo a los medicamentos contra el VIH, las hepatitis virales y la tuberculosis debe ser una prioridad para los Estados, ya que resulta una condición necesaria para promover el efectivo goce del derecho a la salud de todas las personas. Desde agosto de 2022, la nueva Ley 27.675 de respuesta integral al VIH, hepatitis virales y otras infecciones de transmisión sexual y tuberculosis incluye el acceso a pruebas de detección diagnóstica como el método molecular GeneXpert, en el que el Ministerio de Salud argentino ha realizado una importante inversión. La Argentina ha participado activamente de las reuniones de alto nivel realizadas en los últimos años en el ámbito internacional, apoyando plenamente los compromisos y llamamientos establecidos a poner fin a la tuberculosis. Atento a poner fin a la epidemia de la tuberculosis para 2030 es una de las metas de salud de los ODS. El desafío por delante plantea la necesidad de revisar todas las estrategias, sobre todo cuando aún queda por resolver el impacto de la pandemia COVID en el comportamiento de la tuberculosis, que se vio inmersa en el bolsón de patologías postergadas, consecuencia de la respuesta global a la emergencia. Muchas gracias.
Thank you so much. I now invite Blessy Kumar from Global Coalition of TB Advocates. You have the floor.
Very much. I'm sorry about the mix-up. So this is taken from the joint statement of the WHO Director General and the Civil Society Task Force. And this second UN high-level meeting on TB represents a critical opportunity to renew the commitments, mobilize political will, and revamp efforts to end the TB epidemic. Furthermore, we believe that TB needs to also be a priority in the UN high-level meetings on universal health coverage and on pandemic preparedness, prevention, and response, which are taking place tomorrow. We emphasize the need for the following actions for considerations taken from the joint statement. 1, mobilize sufficient and sustainable financing. 2, ensure accelerated people-centered actions with bold strategies on the latest approaches ensuring universal access to TB prevention, treatment, and care. 3, encourage all sectors and stakeholders to work together and establish and maintain high-level multi-sectoral mechanisms in all high TB burden countries. 4, strengthen the engagement of civil society, TB-affected communities, and TB survivors as equal partners in all aspects of the national TB response. Accelerate the development of safe and effective TB vaccines and facilitate their equitable global access. We must recognize that the world has failed the people affected by TB, and the present situation, as I said, is totally unacceptable. We failed in our commitments made in 2018 at the GA HLM. Progress has been slow, and COVID-19 further hindered the progress. Those of us from the Global South still struggle to have equitable access to quality diagnostics, treatment, and care. We do not fully enjoy the benefit from the research and development tools due to slow update in the countries. Today, you who hear us as we bring the voices of thousands from across the globe, you have the power to change that. We urge you to act now. The high-level commitments made must be honored, upheld, and held accountable. Act now, so that if ever there is another UNHLM on TB, it will be to celebrate progress and the lives saved. Thank you very much.
Thank you so much. I now recognize James Sir from United for Global Mental Health. You have the floor.
Ladies and gentlemen, without addressing mental health, there will be no end to tuberculosis. It is estimated that as many as 14 million TB infections can be avoided now and in 2030 by investing in mental health services as part of the TB programs. This high-level meeting on TB is an opportunity to mobilize political commitment to integrate mental health into TB programs within the context of universal health coverage. When we talk about integrating mental health into TB program, we mean first, making mental health and psychosocial support just as important as physical health care for people living with TB. Second, including mental health in all integrated, people-centered services across the continuum of care for TB, including prevention, diagnosis, treatment, and care. And lastly, ensuring coordination mechanisms are in place for collaboration and accountability across health programs. We call on the governments and political leaders to strengthen platforms for collaborative action on TB and mental health that are functional at the national, regional, district, and facility levels. And as part of this effort, we must also meaningfully engage people with lived experience, their caregivers, and the civil society organizations. We must also commit adequate financing to ensure that mental health services are accessible to those receiving this care. We need to strengthen links between national TB programs and existing mental health services to deliver stepped care across the continuum of TB services. Lastly, we have to integrate mental health into routine health information systems to better understand the prevalence of these mental health conditions, as well as their association with TB outcomes. These are the steps that we need to fully integrate mental health into TB programs, which is essential to maximize progress toward global targets to end the TB epidemic. Again, without addressing mental health, there will be no end to TB. Thank you very much.
Thank you so much. In the interest of time, to allow everyone to speak, we should keep our interventions to at least one sentence. At this point, let me invite United Republic of Tanzania to make your interventions. Thank you.
Hello, everyone. My name is Nema Lugangira. I'm a member of parliament from Tanzania. And I just want to reaffirm the commitment and political will from Tanzania by Her Excellency, our President, Dr. Samia Suluhu Hassan, and also the commitment of Tanzania towards championing the end of tuberculosis, as well as UHC and pandemic preparedness. Currently, Tanzania is working on an initiative to make sure that the testing of new cases, diagnosis should be done at community level, rather than waiting until one goes to the hospital. So I think it's very important in the declarations to also recognize such community interventions rather than waiting for diagnosis to take place at hospitals. But also secondly, very quickly, it's very important for vaccine development. Like in other countries, in Tanzania, most of us get the TB vaccine at infant age, but there are still new cases of tuberculosis. That means there needs to be vaccine development for tuberculosis. As a parliamentarian, I must also reaffirm that it is important that it clearly resonates how the TB interventions will include parliamentary engagement, because we're talking about issues of financing, issues of accountability, issues of public awareness, and in all of these issues, parliamentarians have a clear and direct mandate. So it would be very important to also make sure that we clearly map out the engagement of parliamentarians, but also CSOs and parliamentarians can work hand in hand, and CSOs can be can be an avenue for us as parliamentarians to get evidence-based for our own advocacy and decision-making. Finally, we must not forget the importance of looking at community health centers and cross-border regions. Thank you.
Thank you so much. Thank you so much. I now invite Juliana Soares from FHI 360.
Good afternoon, colleagues. Prior to the COVID-19 pandemic, there was rapid progress toward meeting global TB targets. The COVID-19 pandemic, the measures adopted to contain it, and associated service disruptions caused unprecedented strain on global TB progress. Efforts to get back on track to end TB and achieve universal health coverage are linked. To ensure that everyone, including those affected by TB, can obtain the health services they need, when and where they need them, without suffering financial hardship, we need to build on what has worked during the pandemic, highlighting resilient health systems approaches. Our asks are: center all efforts on people and communities. Communities need to be at the front and center of everything. Rebuild strong health systems, prioritizing primary health care. Engage, equip, and empower the health workforce, public, private, and community, no one left behind. Multi-sector collaboration, ensuring political commitment, investment, and tailored implementation mechanism. Strengthen social protection schemes to prevent catastrophic out-of-pocket costs. Public financing of TB services in private and informal sectors through social and health insurance packages or contracts that minimize out-of-pocket costs. Investment and support for community-led systems to reach the most vulnerable and marginalized with essential services. Thank you.
The last but one intervention will come from India. You have the floor.
Thank you, Madam Moderator, distinguished speakers on the panel. India remains committed to eliminate the high-burden infectious disease by 2025, 5 years ahead of the global target. Allow me to share some perspectives on how we are addressing the tuberculosis challenge in India through multi-stakeholder and multi-sectoral approach. In India, we have taken an inclusive approach with active participation of public. Nikshay Mitra campaign is providing nutritional and emotional support to patients and has benefited 1 million TB patients, making it one of the world's largest community initiatives for TB. Through TB Mukt Panchayat Abhiyan initiative, that is, campaign to end TB at the village level, the government of India aims to empower more than 500,000 villages in India to support national efforts in TB prevention and care. India has adopted 5T approach, that is, trace, test, track, treat, and technology for combating TB, and an enhanced use of technology and innovative approaches to deliver effective TB services. India has completed the world's largest national tuberculosis prevalence survey, enabling the government to make targeted interventions. India is the only country in the world to implement a subnational certification exercise, a scientific method through which districts are verified for their progress of elimination. Since 2018, direct benefit transfer through cash incentives to TB patients aimed at improving nutrition has benefited nearly 8 million TB patients, with about $260 million having been disbursed. India has identified concerns of global importance as priorities under its G20 presidency. These include improving effectiveness and reach of health services using digital solutions, strengthening cooperation to enhance pharmaceutical development and manufacturing capabilities, dealing with antimicrobial resistance, focusing on One Health, and all of these have strong resonance with India's and the world's fight against TB. At the One World TB Summit held in India in March 2023, Honorable Prime Minister of India underlined that our civilizational ethos, Vasudhaiva Kutumbakam, that is, the world is one family, is a reflection of India's ideology and mention that we strive to create a world where everyone can live with equality and dignity and free of the ill health and infectious diseases such as TB. India is in a unique position to strengthen the global TB response due to its advancement in technology, digital innovations, data science, and epidemiology. India's pharmaceutical industry meets almost 80% of the global demand for TB drugs. India will be happy to share its experience and know-how with other countries. India remains committed to our collective efforts in purposefully and effectively fighting the persisting challenge of tuberculosis. I thank you.
Thank you so much for all your interventions. At this point, I'll give an opportunity for the panelists to make their final remarks and statements, starting with Parana. Over to you.
Thank you, Madam Chair. So, from me, it's we need to really hear the voices from the people affected by TB, because the best teacher is to learn from someone who have experience and live with it. So start from now. Let's put the people affected by TB as a center and also discussion to end TB. Thank you.
Thank you so much. Chamron, you can now make your final remarks. Over to you.
I just want to say that it is very important that response to TB have to require multi-sectoral partnership, which include civil society and TB-affected community, and like Paran mentioned. So very important that this civil society and TB-affected community have to be equal partner in all the process of TB response. And I hope that if we can work in that way, we will end TB. And through that way, and with the funding support to them, we absolutely can end TB. Thank you.
Thank you so much. We now turn to you, Tina, for your final remarks.
Sadly, when all attention was focused on COVID-19, TB was forgotten with dire consequences. And even here, while in New York and speaking with missions, I am learning that TB may be left behind again in terms of prioritization alongside other high-level multi-stakeholder and UN General Assembly events taking place here in September. In Canada, disruptions to programming and care caused by the pandemic resulted in TB deaths increasing for the first time since 2005. Some of those who didn't lose their lives to TB were left with lifelong disabilities as a result of delayed diagnosis. We have to remember that COVID-19 was just one event. We have been living with a population-specific burden of disease that is unfair for decades. And in 2023, with all our resources and advancements, nobody should be facing death from a preventable and for more than 70 years, curable disease like TB. No group in this resource-rich nation and world should be so unfairly affected. We must reach all people affected by tuberculosis with prevention, diagnosis, treatment, and care by implementing evidence-based and quality interventions and tools as per the latest international guidelines. Today, I feel this overwhelming and tremendous weight on my shoulders to speak for those most vulnerable to TB disease. I would like to see more people in all vulnerable groups be consulted and considered when making program policies and decisions. We cannot afford to fail any longer. By failing to end TB, governments are failing to uphold the rights of Indigenous peoples and to make good on commitments to reconciliation. With collaboration, commitment, political will, and compassion, yes, we can end TB.
Thank you so much. And now we will turn to you, Professor Ibrahim Abubakar, for your final remarks.
Thank you. So for me, I was here 5 years ago, and we asked of our leaders a number of demands, just like today. While we've had some progress, we've also had a number of setbacks. So I'm asking for those writing the draft of this agreement to please listen to the community and all we've said and include that in the draft agreement. But I also ask that we ask of our leaders in September to agree to an independent accountability mechanism so that the next time we gather, we're able to hold them to account that they've done the things that they said they would do. I also demand that we work together across the global health community, across PPR, UHC, and TB to deliver the signages and gains needed. And finally, I ask for equity and for any interventions, discoveries, and demands to reach the most vulnerable. Thank you.
Thank you so much for the powerful interventions and, of course, speeches and, of course, submissions from the panelists today. We understand that there were many people that wanted to speak from the floor. I also wanted to remind that those representatives who are not able to deliver their speech and statements are kindly requested to submit their statements to Indigo to be posted on the World Health Organization website. Before I close, I would like to remind participants that the second panel discussion entitled Mobilizing Adequate Sustainable Financing to Ramp Up the TB Response and Advance Research and Innovation will begin immediately after the conclusion of this panel discussion. I would like now to invite the moderator and panelists of the panel discussion 2 to take their seats at the podium. The panel discussion 1 is now concluded.
Your attention, please. We will now begin the second panel discussion entitled Mobilizing Adequate and Sustainable Financing to Ramp Up the TB Response and Advance Research and Innovation. It's now called to order. Good afternoon. My name is Harry Hausler. I'm the CEO of TB HIV Care, which is a non-profit civil society organization in South Africa that delivers TB and HIV prevention services to the general population as well as different key populations, as inmates in correctional services, sex workers, people who use drugs, and a big program for adolescent girls and young women. I'm a member of the Civil Society Forum TB Task Team in South Africa and the World Health Organization Civil Society Task Force on TB. It's an honor to be here. Thank you. Our panel today will start with a storyteller, Olga Klimenko. Olga is a TB survivor from Ukraine. She's the founder and chairperson of TB People Ukraine and is the alternate board member representing communities at the Stop TB Partnership Board. Olga and TB People Ukraine were the winners of the 2022 Stop TB Community Award for their work taking community-led monitoring to scale, even during a time of war and conflict. Then we have a young researcher, Dr. Nguyen Viet Hai, is a young researcher from the Vietnam Integrated Center for TB and Respirology Research and the Vietnam National TB Program. He's the founder of Youth Network on TB and WHO 1+1 Youth Initiative to End TB. Then we'll have Dr. Özlem Turici, who's the Chief Medical Officer and founder of BioNTech, a global, fully integrated next-generation immunotherapy company pioneering novel therapies for cancer, infectious diseases, including TB vaccine development, and we're all eager to hear about TB vaccines. Dr. Ethel Maciel will then speak, and she's the Secretary of Health and Surveillance in the Ministry of Health in Brazil. She is a well-renowned researcher dedicated to the control and prevention of infectious diseases, and in particular, the investigation of TB prevention and care. She was formerly the president of the Brazilian TB Research Network, and in the last 12 years, she's been working in collaboration with the Ministry of Health to monitor the epidemiological data from the Brazilian national surveillance systems. Finally, we'll have Dr. Eliud Wondwalo, who is the head of the TB Technical Advice and Partnerships Department at the Global Fund to Fight AIDS, TB, and Malaria, a very important TB donor. He is a medical doctor with over 23 years of public health experience. So now, just to remind everybody, if anybody has submitted papers in the first panel, you don't have to resubmit the papers, but you can put on your microphone now to indicate if you're interested in speaking in the second panel. And for those who haven't already submitted papers, please prepare them. So before giving the floor to panelists, I'd like to inform the participants that those wishing to speak during the interactive discussion are kindly requested to press the button located at the base of the microphone in order to be placed on the list of speakers, and fill out a paper if you haven't already done so with your name and organization. Representatives of the Secretariat will then walk around the room to collect the white papers of those wishing to speak. Those seated in the gallery without access to a microphone should approach the attendant in their section. After your name has been collected, please deactivate your microphone. Participants may indicate their wish to speak starting now. They will be collected to speak after the presentations by the panelists once the floor is open for the interactive discussion. So let's start our panel. And I'd like to invite Olga Klemenko to tell us her story as a TB survivor.
Thank you. Good afternoon, participants of the Multistakeholders Hearing. I'm from unbreakable and independent Ukraine. I'm the mother of 2 daughters, and together with my eldest one, we went through all the challenges associated with TB treatment. And so, in medical terms, we have overcome this disease. Its track will be with us forever. We were separated for hospitalization for longest 4 months in my life. I lost my job, have a severe depression, and my daughter got a psychologist trauma, which eventually led to mental health discarded now. And with this, she must live her life further because it's not curable. I imagine not this kind of future my child. At that time, in TB care, there were only pills which I had to take every day, despite of several side effects. My recovery lasted for 2 years, followed by a suspected relapse. This is something that everyone who had TB experience is afraid because it means that you have to relive it all over again. I know that if I would be aware of my rights, things could have been different. Since thanks to our joint efforts and international support, new diagnostic, drugs, and short treatment regimes BIPAL became available in Ukraine, with standardization of services and legislation reforms. However, a cruel and unprecedented war pushed us and our achievements years back. Hundreds of children were killed as a result of Russian military aggression against Ukraine. During the year of the war in my country, not only more than 200 hospitals were completely destroyed, but a new enemy is a target to achieve good treatment results. People with TB is killed during the brutal attacks. The war impacts everyone, as the massive displacement fled the country to way of panic around the spread of TB. We didn't want to become refugees, but we weren't given a choice. Bomb shelters, stress, humanitarian crises, ruined hospitals, schools, homes. It pushed us back, but it didn't stop us. We are fighting for the future of our children and for Ukraine. In wars, there are no winners. It's a loss for humankind, its development, and every day we are paying an extremely high price. Lost human lives, our lives. Despite of the war, united as never before, we were able to maintain services, establish roads to deliver medicines, and scale up to provision of remote services. We are ready to challenge the road of recovery after the war ends. However, Ukraine needs help, so we can come back on track in achieving our goals to eliminate TB by 2030. In the last 5 years, community capacity development and community engagement in TB response allowed considerably improving the quality and integration of services. TB requires multi-sectoral approach and responses. This is why it's so important to involve affected communities in all stages of development of national TB policy. Communities need to be informed, engaging, and resources to play a key role in advocating for rapid innovation uptakes. This engagement was possible only with support of the Global Fund and Stop TB Partnership. We need Global Fund and other donors to join USAID and government on France in funding to ensure that TB-affected communities receive the funding they need to support their countries in ending TB. I request from all governments and stakeholders to create the universal access to fast diagnostic of TB and TBI for all affected people, universal support for short treatment regime, implementation with social and psychologist support to speed TB vaccine development for universal protection and for end TB in nearest time. In 2 days, my youngest daughter will be only 11 months old. It's the first time she's been far from me. I really want to hug and warm her. However, we are separated by half the globe. Today, I must be here with you and to stand for the rights of people with TB, where they will not be discriminated against, and where this deadly bite, curable disease will be forever eliminated. Please, when making a decision on the next political declaration, just remember our stories and think about the destiny of the 40 million people who need access to TB rights-based and people-centered care. Take care about us. And only then can we say that we have achieved political leadership in the fight against TB. I believe in that. We can end TB, and please stand with Ukraine. We really need it. Thanks.
Thank you so much, Olga, for your very powerful story. And we need to listen to the voices of people affected by TB, like you. So, Dr. Hai, we've seen during the COVID-19 pandemic how fast new tools and innovations were developed and rolled out. As a young researcher, building on your experience in Vietnam, what would be your message on how to make the TB response more innovative with faster development and uptake of new tools?
Thank you, Mr. Moderator. And greetings, ladies and gentlemen. First of all, I would like to give my thanks to the organizer and to you all for coming to this important hearing. As we all know, the COVID-19 pandemic has caused many negative consequences in our daily life, and it pulled back years of global TB control efforts. However, it also showed us that we can contain a pandemic in a short time if we have enough funding, enough technology, enough human resources, and research. TB and COVID-19 have so many similarities, and we have invested so much to fight COVID-19. So why not for TB? We have to know that we have enough funding, human resources, and technology and research for COVID. And as the mindset of the policymakers and the public have changed dramatically after COVID-19, we have to make a move now. The countries and funders have to make a move. We have to focus on TB research and development to turn the COVID-19 disaster into the excellent opportunity to end TB. Vietnam, as one of the countries with the highest TB burden in the world, have been actively engaging in TB R&D in the last decade. Our studies have shown the possibilities of ending TB globally, but we cannot do it in due time using the current tools. We need a new vaccine, new drugs, shorter regimens, and point-of-care tests that can detect TB at the primary care level. Like COVID, we can have them in our hand if we have enough funding and human resources for TB R&D. And high-burden countries like Vietnam have to be more accountable to promote and to support TB R&D. Yes, thank you. 6 years ago, when I just joined the Vietnam NTP as a young researcher, I was so inspired and impressed by the senior TB staff. I was inspired by their professionalism, by their eagerness and dedication to TB research, but now most of them have retired. We need more young people working in the fight against TB, especially in TB R&D, so that the pool of TB researchers will not dry out. And young people with their unique mindset and the ways to communicate are the drivers of social progress and can act as a catalyst for ending TB. As a founding member of the Vietnam Youth Association Against TB, my colleagues and I have organized many campaigns that follows the WHO 1+1 Youth Initiative on TB. We travel across the country to reach thousands of students to raise their awareness and knowledge on TB, and we ask them to spread the word to their families and friends so that we can engage the whole community. We believe that we have lit a small fire inside them, and maybe someday these students will become our new colleagues. Having TB is not shameful, but letting people die from it without doing anything is. As one of the youngest here in this room, I want to raise my voice once more to highlight the need of investment in TB R&D and in young people. I'm expecting my newborn soon, and I know that many parents is in this room. Let us give our children the future they deserve, a world where TB is no more. Thank you very much.
Thank you, Dr. Hai. I now give the floor to Dr. Özlem Türeci. Dr. Türeci, what is needed from a private sector perspective to generate the right framework for development and uptake for new TB vaccines?
Ladies and gentlemen.
Okay, this works now. Ladies and gentlemen, the availability of safe and efficient vaccines will play an important role in achieving the global mission to end TB, and the private sector requires the engagement of the private sector. We are living in times in which breakthroughs in TB vaccines are not fictional anymore. We can build on scientific advancements and disruptive technologies, and we can build on the practical experience gained by all stakeholders in the COVID-19 pandemic on how novel vaccines can be developed and can be operationalized, and how science can be translated in survival and health. When it comes to science and technology, I, as a trained physician scientist, I'm very much excited about the mRNA technology toolbox, and I'm excited about the progress in understanding mechanistics of immunity and of immune therapies in non-TB and even in non-infectious disease areas, which will cross-fertilize TB vaccine development. That TB vaccine breakthroughs come into grasp, this in itself is creating motivation, also motivation for the private sector to commit. My company is an example. A couple of years ago, TB was not on our agenda, but seeing the opportunity and feeling the obligation, a couple of weeks ago, we dosed our first participants with our new multi-antigen TB vaccine candidates. What is needed from the private sector perspective to actualize the potential presented by this unprecedented convergence of science, technology, and momentum which surrounds us? Financing of research and of development in the endemic countries is an important piece. De-risking is another important piece, and both are entangled, because risk means investments that, rather than serving the grand cause itself, are used for mitigation, for dealing with uncertainties. It is this portion of investment that creates engagement barriers for the private sector. Real de-risking of vaccine development and uptake has to happen with an end-to-end mindset, considering research, development, licensure, manufacturing, and access of TB vaccines as a continuum. Among the measures required are deep partnerships with the endemic countries that include an enabling environment for research and development, including quality ethics review committees, strong research partnerships, agile and fast delivering clinical networks, clinical trial capacity, and it also includes political and grassroots community support. Further needs are timely and predictable national and international regulatory systems that are coupled to guidelines and policy-making processes that ensure transition to achieve impact. Importantly, regulatory frameworks are needed that support those strengths of emerging innovations that may accelerate breakthroughs in developing vaccines. For example, the promise of the mRNA technology can be better actualized by straightforward, bespoke regulatory frameworks for platform technology approaches or for decentralized manufacturing in endemic countries. A supportive international financing landscape is required both for research, for example, improving our understanding of TB pathogenesis and immunobiology and epidemiology, but also for development, for private sector engagement, the arsenal of available tools such as social impact bonds, tax incentives, priority review vouchers, advanced market commitments could be leveraged more systematically also in the TB field. Last but not least, a political and multi-stakeholder environment that stimulates initiatives that lower market uncertainty for TB vaccines. Is this achievable? I believe it is. There is a robust foundation to build on. Never before has there been this level of momentum, and we can sense this by the energy in this room. So if not now, then when?
Thank you so much, Dr. Turecci. Now, just before we go to, we have two more panelists. I would just want to remind participants that those wishing to speak during the interactive session are kindly requested to press the button located at the base of the microphone in order to be placed on the list of speakers. I now give the floor to Dr. Ethel Maciel. Brazil has recently demonstrated impressive progress in translating commitments to bold action, especially through multi-sectoral engagement. Can you please highlight how shared responsibility and resources across sectors can help to tackle the core drivers of the TB epidemic, including advancing TB research and innovation?
Thank you, Mr. Chair. And good afternoon to everybody, to my colleagues, to my friends for the TB community. As you heard, I'm a research that in the last 4 months changed my hat to be a member state. And right now I have this huge responsibility to translate everything that I learned when I was a younger research in 25 years ago to in this right moment, right now with you. So I'm very honored to be here representing Brazil, but also my friends for the Latin American and the developed countries. Brazil is a TB, is a high burden of TB, and this new government that just beginning in the last January, they are very committed with the TB in Brazil, and with the leadership of President Lula and our Minister of Health, Nízia Trindade, we create a decree that combine 9 ministers in Brazil, and this is like a very important initiative that has Minister of Health, Science and Technology, human rights, and more 5 ministers combined to fight against TB in Brazil. This is a multi-sector approach that catalyzes a lot of progress that I will talk a little bit, and leverage resources across sectors to address key drivers of the TB epidemic in Brazil, include the fight of poverty, malnutrition. That is a very important problem in Brazil right now. Population in vulnerable situation, such as indigenous population, homeless, migrants, people in prison, and people living with HIV. That I would like to highlight the importance of the civil society and the TB research community to independent of the government to fight always against this problem that we are facing in Brazil, in a lot of the nations right now. In this first month of the new government, we increase the domestic funds for research and in civil society. And for you to have an idea, in the last 10 years in Brazil, we have the same amount of the funds that we put in this first year of the new government. So this is the huge effort for us, for the domestic funds. But we are committed with the NTB. Brazil is also leading efforts in advancing research and innovation through national and international collaboration network for research. I'm the former president of the Brazilian TB research network, and that was pointed out as a model for the WHO for other countries to do this kind of collaboration and network. And also, this network was a model to build the TB BRICS network that was very important to these 5 countries. That was, it's a model to transfer technology, transfer some data. It's a platform to make this equitable uptakes new tools. I'd like also acknowledge WHO support to the BRICS network, and welcome to the General Director on the announcement of the TB Access Vaccine Accelerator Council, which is Brazil's plan to be part of, engaging. We are absolutely sure, I think all of us, that without a new vaccine, strategy to control TB will be less effective. But have a vaccine is not enough. We need that this vaccine is be affordable for all countries. This is very important, and it's a priority to Brazil right now, and for all countries that has possibility to have the transfer of this technology. And this is very important point to us. We learn with the COVID-19 pandemic how the inequality for the access to the vaccine was in our old. So we cannot make the same mistake. We need to put this in advance. We need to put our commitment with the affordable price in advance. So, Mr. Moderator, I'd like to thank you for the opportunity to talk about this. This is very important for our developed country, and we need in the declaration, this new declaration, to highlight the importance of funding, collaborate research, combine with commitment with universal health access, for promote innovation to all. And we need to do this right now in this declaration. The market price is very important. We need to put lives before, and we need to say that people matters, all people matters in all countries, and developed countries needs to have this huge possibility that we had to make our medicine, our vaccine, and to discussing the transfer of technology for our country and for our people. So thank you very much. And I also, with all of this audience, believe that we can end TB right now with all of us together. Thank you.
Thank you, Dr. Maciel, for your inspiring words and the need for multi-sectoral approaches and equitable, affordable access to new tools. I now give the floor to Dr. Eliud Wandwala. It is well known, Eliud, that funding from international donors like the Global Fund is vital to accelerate the TB response, especially for many low and middle income countries. At the same time, significant funding gaps exist both from domestic and international sources. And this remains one of the biggest challenges to expand access to quality TB prevention, diagnosis, and care. What could be the ways forward and perspectives to address the major resource challenges?
Thanks, moderator, for the opportunity. I believe I'm the last speaker, not because funding is not important, but probably you have decided to keep the best for the last, because let's be honest, all what we have discussed, without funding, nothing will happen. I believe that what stands between the senseless death we are seeing in tuberculosis and ending TB is money. and it's more urgent now than before. So the TB response has been really implemented with the chronic underfunding for so many years. But the business case of really funding TB is very clear. It's the largest killer, infectious killer, and probably this year will surpass HIV. It's a curable disease. TB is a pandemic. It was announced global emergence over 30 years ago. And we know also investing in TB is a smart investment. The return on investment on tuberculosis is huge. For every dollar invested in TB, there is $40 which is gained only by investing in TB. The Copenhagen Consensus has put tuberculosis as one of the cost-effective, impactful interventions. So I think the case is very clear and it's very solid. My organization, the Global Fund, is investing around 800 million a year on tuberculosis. And yet, we are the largest funder internationally for tuberculosis. But let's look at the 800 million. In the larger scheme of things, this is just a budget of mid-sized hospital in most developing countries. So that shows the limited funding which we have in tuberculosis. Stop TB global plan is very clear. We need 15 billion from this year to mount a full TB response. We need about 22 billion by 2026 and 35 billion by 2030. If you look at this, you will think this is a lot of money. But if you see what we have invested in COVID, this is just a fraction of the funding which was invested in COVID. So we really need to invest in tuberculosis, and we need to make sure that countries invest their own money on tuberculosis. What we would wish to see in September is that countries come with a roadmap on how they can full fund a TB response. It's not just to be able to full fund TB response, and the global plan is very clear on how countries will be able to full fund TB epidemic. We need that roadmap to be very clear with a target and with means to be able to verify that funding. We also need to make sure we increase international funding for tuberculosis. As I said, our organization, which is the biggest funder for tuberculosis, we only invest 800 million per year. We need much more to invest in organizations such Global Fund, which is supporting most of the developing countries. Investing in tuberculosis has triple benefit. One, we can turbocharge the fight against tuberculosis and save more life. But also, by investing in tuberculosis, we are creating a platform for universal health coverage, as we have seen in Japan, where they used investment in tuberculosis to create a platform for UHC. But also, investing in tuberculosis is actually investing in the pandemic preparedness, because tuberculosis is a pandemic. While we are talking about preparing for the next pandemic, why don't we work to eliminate the current pandemic? And this will be really a demonstration and a commitment that we are serious on preparing for the next pandemic. Us, in the Global Fund, we have a mechanism to support COVID. We call C19RM. And what we did with that funding, we made a very clear case that investing in the pandemics such as COVID is actually, it will make sense to invest in tuberculosis. And our organization, with the support of all partners, we were able to invest a lot in tuberculosis, and 25% of all funding which went into the COVID response, especially with the what we call portfolio optimization, went to areas which could also support TB. And we really need to make that case. There is pandemic fund now under World Bank. We must make sure that 25% of that funding goes into activity which will also support tuberculosis. And I think that case is very clear, and we need to make that. The cost of inaction, of not investing or continue with business as usual, is very huge. between now and 2030, we'll lose about 6 million people if we continue with the current trend. The infection will increase by almost 43 million, and the cost to the global community will be more than 1 trillion. So we cannot afford not to invest in tuberculosis. The reasons which we had before not investing, they are no longer holding. We were told before COVID that there's no money, but COVID has demonstrated that there is money if there's a will. We were told before that TB programs, they are not investing money. But in the Global Fund now, I can assure you, all TB programs, they are absorbing money. Absorption rate for TB is more than 80%. So this reason doesn't stand. We were told that there's no capacity in TB programs. But we have seen in the COVID pandemic, but even now with the result we are seeing from WHO data which they are collecting, that programs are very ambitious. Currently, at the Global Fund, we are receiving funding requests, and we have seen countries are very ambitious. What stands between scaling up and continue with the business as usual is funding. So I think at the moment, the critical issue is no longer capacity, is no longer absorption, it's the funding. And at the Global Fund, we have seen a direct correlation between more funding and more implementation. So I think what I want to say is that I think there's urgency now. Most programs, they can deliver, they can absorb money, and what stands between the death we are seeing and ending TB is funding. Thank you.
Thank you, Dr. Wandwalo. What we need is more funding, and we need urgency, as you said. I now open the floor for comments and questions. So once I give the floor to a participant, I would request the speaker to press the microphone button at that point. The green light on your microphone will guide the technician to activate your microphone. Once the light on your microphone turns red, indicating your microphone has been activated, you may proceed to make your intervention. I appeal to everyone again to allow maximum participation by all present, to limit your interventions to 2 minutes. The timer has been installed on the screen to assist speakers with the time management. I'm going to call on the first person for an intervention is Dr. Mel Spiegelman from the Global Alliance for TB Drug Development.
Thank you very much, Professor Hausler and the organizers of this meeting. I represent the Product Development Partnership, the TB Alliance. And clearly we urge all world leaders to unleash the power of science and the best qualities of humanity to finally end TB. In spite of all of the headwinds that COVID-19 has presented, there have also been tremendous advances in TB treatment that have been achieved in the past few years, including improved cures for latent infection, drug-susceptible, and drug-resistant TB. And thanks to long-term investments in TB research and development, virtually all cases of drug-resistant TB can now be treated with similar timelines and results as for drug-susceptible TB. That means 6 months of treatment with 3 or 4 oral drugs and a 90% cure rate. But furthermore, the treatment is 40 to 90% cheaper on a per-patient basis and is estimated to save over $740 million per year compared to standard therapy not that long ago. That savings will free up critical resources for thinly stretched healthcare systems in high-burden countries. Most importantly, it underscores how cutting-edge science can produce not only marked improvements in results, but also at a reduced cost. And although the novel treatment that I mentioned for DRTB is now prioritized by WHO and is being taken up at a rapid pace in several countries, we can and we must do better at ensuring rapid and equitable uptake on a global basis. We fully endorse WHO's call to action issued in March and strongly urge world leaders to ensure that all eligible patients worldwide start receiving this treatment by 2024. But despite such advances, if we are to end TB, we must do better. And it's eminently possible and even highly likely that treatment of all forms of TB can be significantly further improved, but as Elliot mentioned, only if more resources are made available. The major impediment to transformative innovation is a lack of adequate funding. A substantial boost in TB research funding to $5 billion per year would produce dramatic results in achieving the goal of ending TB. This would bring about vaccines, diagnostics, and treatments that together could finally eradicate the age-old scourge of TB. We need to act now. Thank you very much.
Thank you. I now call on Erlina Burhan from the Stop TB Partnership.
My name is Erlina Burhan. I'm presenting private provider constituent. As we all know, more than 50% of TB people go to private provider in majority of countries. But the fact is that private providers are always being blamed for suboptimal diagnostic procedure, low success rate, and low notification rate. Why do I know? Because I'm a double agent. I work at private and also public hospital. So everyone, instead of blaming, why not supporting us? Please support us to have access for appropriate and newer innovation of diagnostic tool, helping us in having access for new screening tools such as artificial intelligence and recent biomarker testing. Support us to have access for good quality of drugs and the new drug regimen such as 4 months regimen for drug-sensitive TB and 6-month regimen for DRTB such as BPAL-M and BPAL. It is so awesome, only 6 months. It's so promising. My patient got sick of being treated for 7, 11, or 20 months. To tell the truth, we, the provider, get sick also in giving that long treatment, not mentioning managing all the side effects. And now there's several TB vaccines are in the pipeline. Please include us, the private provider, in the clinical trial activities also. So I would like to ask in the political declaration, I want to see that private provider being supported with all recent technology, innovation, financial support. I'm talking to you, Elliot. For screening, for diagnostic, treatment, prevention action, and research as well. If I don't see this in the declaration, I would say that is embarrassment. Shame on us. So please include us. If you include us, yes, we can end TB. Thank you.
Thank you. From the private provider perspective and the double agent perspective. Now I'm calling on Maka Gombe from the Orem Institute in South Africa.
All right. So the Orem Institute works on doing research, translating research to policy and policy to practice. So my statement comes from lessons from the field. To end TB, we need to prevent TB. Member states need to provide the best available TB preventative treatment as recommended by the WHO. These include short-course TB preventive treatment regimens that can be completed in as little as 28 days or 12 weeks. The Stop TB Partnership has asked that member states commit to provide TB preventative treatment to 35 million people. Since the last UN HLM on TB in 2018, we met the targets for people living with HIV, but we left 3 main groups behind within this group: children, adolescents, and pregnant people. Member states need to invest in reaching the groups that have been left behind. We did not meet the targets for TB preventative treatment in contacts of all ages. Member states need to invest in contact tracing to identify people exposed to TB eligible to receive preventive treatment. We saw that contact tracing is feasible during the COVID-19 pandemic. May we take lessons for TB? Member states should invest in doing research to develop more potent regimens and how to tailor service delivery and medicines to different groups in order to improve treatment uptake and completion. And this includes an investment in mental health and nutritional support. Finally, member states need to work with manufacturers to improve sustainable supply and affordability of quality-assured medicines. This will involve ease of registration of medicine manufacturers to supply their products and/or facilitate regional manufacturing of these products. Finally, we hope that the political declaration will include a commitment to prevent TB through the provision of TB preventive treatment through all the interventions that I've mentioned. Thank you.
Thank you, Maka, for highlighting the importance of TB preventive therapy. Amrita Daftari from York University in Canada.
Thank you. Thank you. I'm Amrita Daftari, a professor and TB researcher from York University and founder of the Center for Social Science and Health Innovations for TB, Shift TB. We're a global network of social science scholars and affected community representatives. Thank you for today. I make two requests. They're feasible, they're fundable, and I think they'll be impactful. First, TB-affected communities, human rights, and gender has to be at the front and center of any TB response, from funding, from R&D, from programming to monitoring. There have been some breakthroughs, but we're not there yet. We're not universally engaging those infected by TB and having a say in what happens to them. When, where, how, by whom, for how long, in what ways. For too long, we failed to prioritize their social, economic, and legal traumas to uphold their rights and their basic dignity. This has to end now. Let's draw on the community rights, gender, and stigma assessments completed in over 20 countries. Let's draw on the Deadly Divide Accountability Report that was contributed through by 1,000 TB-affected community and civil society representatives. Thank you to you all. And let's move from from commitments to targeted action. By 2025, every country should undertake a community's rights, stigma, and gender assessment and develop a costed CRG and stigma action plan that's led and monitored by TB-affected communities and civil society. Second, the TB research and development agenda has to include social science research adjacent to biomedical research and innovation. Social science research is the approach to unveil the social determinants of TB. Often it's qualitative, it's inclusive by nature, it's participatory, equity-oriented, anti-colonial, and community engaged. It has and can serve as a bridge to mobilize the acceptability and utilization of TB tools, technologies, and innovations, and it's needed to reach all. So starting immediately, funding investment in TB, including TB R&D, domestic, international, private, must include components to address the social determinants of TB and support the social protection of those who live with this disease. I hope the next time we meet, I won't have to remind us of these requests, but we can celebrate in their achievement. Thank you.
Thank you, Amrita. Michael Frick from Treatment Action Group.
This statement is delivered on behalf of Treatment Action Group. The theme of this year's high-level meeting is advancing science, finance, and innovation, and the equitable distribution of their benefits. This theme speaks directly to the central need of the hour: intensified research and financing to develop and distribute new health technologies to end TB. This theme also mirrors the International Covenant on Economic, Social, and Cultural Rights, establishing the human right of everyone to enjoy the benefits of scientific progress, the right to science. Treatment Action Group urges member states to explicitly recognize the right to science as a guiding framework of the TB Political Declaration. This will require member state commitments to TB research in 3 areas. First, states must increase investments in TB research and development. Each member state should contribute its fair share to TB R&D and approach TB research as a shared responsibility. The Stop TB Partnership has called for states to mobilize a minimum of $5 billion a year for TB research, including over $1 billion a year for TB vaccines. Second, Government should direct investments in a purposive fashion to fill unmet innovation needs of groups most vulnerable to TB, including children and pregnant people, and ensure TB research is needs-driven, evidence-based, and guided by principles of affordability, effectiveness, efficiency, and equity. Third, each year, Treatment Action Group and Stop TB Partnership conduct a global survey of TB research funding. We know that 70% of funding for TB research comes from the public sector, so government should require access and transparency conditionalities for publicly funded research. These conditionalities are about maximizing public return on the public investments that drive TB R&D, and they should span the R&D continuum. Governments require access to data on pricing, intellectual property, and research costs to make informed decisions in the manufacturing, purchasing, and procurement of health technologies and technology transfer. These access conditionalities should ensure that incentives for innovation are independent from rights of market exclusivity so that the benefits of TB science can be enjoyed by all while also promoting appropriate use. Thank you.
Thank you, Mike. Next, I'd like to call on Lord Nick Herbert from the Global TB Caucus to hear from parliamentarians.
Thank you. I'm proud to represent the Global TB Caucus, which numbers 2,500 parliamentarians across 150 countries. And since we were formed, we have helped to establish 50 national caucuses in parliaments. On the way here, I stopped at a cafe, and a guy asked me what my PIN was. I told him it was to end TB. He told me that he had had TB when he was age 16 in Ohio. It was a reminder to me that TB anywhere is TB everywhere. But what has changed? What has changed in 58 years? Well, we know that at least 50 million people have lost their lives since then, perhaps twice that number. We don't have the figures. We still don't have a vaccine. Many of us were here in this building 5 years ago for the stakeholder hearings and then for the high-level meeting itself. The declaration that was passed was a fine one, but we know what has happened since. Yes, COVID has knocked us badly off course, but the truth is, if we're honest with ourselves, that we would have been off course anyway, even if COVID had not intervened. And the targets, the bold, brave new targets that were set then to put us back on course to meet the Sustainable Development Goal of ending TB by 2030 would not have been met. That is the reality. And I want to make one key point. Without strong accountability, it is not enough for leaders to be in this building again and to make declarations again when we come to the high-level meeting in September. They must be held to account for what they agree to. They must be held to account for providing the finance and for taking the necessary action to end TB. And without that strong accountability mechanism, we will find ourselves back in this building in another 5 years and in another 5 years, and it is simply unacceptable. We must hold our leaders to account now for taking the action to beat this entirely beatable disease.
Thank you. Accountability. Now I call on the Dominican Republic.
Muchas gracias. República Dominicana expresa su agradecimiento a los panelistas por liderar esta discusión sobre la lucha contra la tuberculosis y reafirma su compromiso firme con la causa. La lucha contra la tuberculosis está gravemente infrafinanciada. Solo ha recibido el 41% de la financiación prevista del compromiso anual de $13.000 millones establecido en la Declaración Política del 2018. La pandemia del COVID-19 ha agravado aún más el problema al detener todos los demás procesos sanitarios para responder a la crisis de emergencia, lo que ha provocado una mayor disminución de la financiación para los programas de tuberculosis. Para combatir la falta de financiación, para la tuberculosis, es imperativo aprovechar las asociaciones de múltiples partes interesadas que reúnen a gobiernos, sectores privados, organizaciones de la sociedad civil, comunidades locales y científicos, como esta. La tuberculosis es una enfermedad en la que influyen determinantes sociales como la pobreza y la discriminación. Por lo tanto, es prevenible y requiere una solución transversal. Debemos utilizar nuestros recursos y conocimientos y nuestra experiencia de la pandemia para idear formas innovadoras de abordar de forma sostenible el déficit de financiación de los programas contra la tuberculosis. República Dominicana, pequeño estado insular en desarrollo y país de renta media, que comparte isla con el único PMA de la región, aboga por el apoyo financiero para una exitosa respuesta a la tuberculosis. Me permito a preguntarles, ¿cómo podemos garantizar que los esfuerzos de colaboración entre las instituciones financieras internacionales y los países de renta baja y media para cerrar las brechas de financiación y aumentar las inversiones en la respuesta a la tuberculosis sean sostenibles, a fin de mejorar la capacidad de los países para responder rápida y eficazmente a la enfermedad a medida que el país se desarrolla? En otras palabras, ¿cómo podemos garantizar que la capacidad de un país para mantener su capacidad no dependa de su colaboración con las instituciones financieras internacionales? Gracias.
Gracias. Willem Honeycomb from the African Health Research Institute in South Africa, please.
Thank you very much. I'm going to talk about TB vaccines and propose that TB vaccines are going to be the magic bullet to control the TB epidemic. We need a vaccine that prevents TB in adolescents and adults, and at the moment we do not have that. So I'm not saying we should not focus on drugs or diagnostics or intersecting epidemics such as food poverty, HIV, or diabetes. My point is that excellent modeling has shown that an effective vaccine will have a much greater impact than any other intervention in controlling the TB epidemic, and that this would result in a massive 1.5 trillion increase in GDP globally. We know that even a vaccine with just 30% efficacy will have a massive impact where TB is common. We have a very promising candidate amongst these vaccines called M72 that's already shown 50% efficacy in an early trial, and it's now entering a funded definitive trial to confirm this result. We are very optimistic about a positive result, and therefore we're planning for success, which means we are planning for the vaccine to be accessible immediately. But there's always a chance that M72 may not work, or that there are better vaccine candidates for the future. Therefore, it's absolutely critical and urgent that the pipeline of promising vaccine candidates also be moved forward, and this cannot be done without political commitment and resources. So toward this purpose, we request inclusion in the zero draft, a very specific commitment for $1 billion a year for TB vaccine research and development. If you can provide the money, we can do the work and we will deliver.
Thank you. Thanks, Willem. Now, we have very limited time, and so I'm asking the remaining people to just give 1 minute. And if I could ask when we wrap up that the panelists try and decrease their feedback to under a minute. So the next person to speak would be Mahmoud Abdulamir from the International Federation of Medical Students Association. Please try to keep it to under a minute.
Thank you, moderator. As we look back on the past 5 years, we recognize the efforts and progress that have been made in the fight against TB. However, as youth, medical students, and future healthcare professionals, we believe more can be done. In the past political declaration, civil society has been mentioned 3 times, highlighting the importance of the whole of society approach and the clear argument that our TB-related milestones cannot be achieved without the meaningful engagement of all community members. We call on member states to review their progress in the meaningful engagement of all society members in the fight against TB and ensure their active engagement in policy design, implementation, monitoring, and evaluation on the national level. Medical students worldwide welcome all contributions on ending TB and emphasize that future healthcare professionals, including health students, should be equal partners in the fight against TB through their education, empowerment, and meaningful engagement. TB can end, and we all must contribute to this through an evidence-based approach that ensures a world safe from TB. Thank you.
Thank you. Call on Saya Kato from the Research Institute of TB in the Japan Anti-TB Association.
Thank you very much for the opportunity. I would like to share the experience of TB control during high TB endemic period in Japan, with special focus on funding and its impact. Japan suffers extremely heavy burden in 1940 and 60s, as was shown by the notification of approximately 700 over 100,000 population. Government invested as much amount of funding as possible to strengthen TB control. By these strategies, Japan achieves average of annual reduction rate in incidence of 10% over 30 years between 1965 and 1978. It is noted that tuberculosis medical cost per percentage of total medical cost declined by about 1/10, from 80% to 1.7% during 2 decades, from 1960 to 1980s. I would like to reiterate that ample investment and sustained investment, as well as proper implementation of TB control program, provide huge financial benefit and contribute to the welfare of the people. The more funding invested, the earlier time comes to end unnecessary funding for TB control. Thank you very much.
Thank you. If I can ask Panama just to give their intervention under a minute, please.
Buenas tardes, delegados, estimadas delegadas. Como científico, hoy me gustaría reforzar la importancia de la investigación y desarrollo e innovación para el control de la tuberculosis. Todos coincidimos que la investigación beneficia a las poblaciones pobres porque va directo a la inequidad en las más vulnerables, mediante los avances tales como desarrollo de diagnósticos, desarrollo de pruebas de biomarcadores, nuevos regímenes acortados de tratamiento, con ciclos más cortos y que curan y salvan vidas. También la secuenciación del genoma ha permitido identificar nuevos medicamentos en la bacteria. Sin embargo, estas tecnologías tienen alto costo y impiden su acceso universal a nuestros pueblos. En realidad, en Latinoamérica, todos los días vemos más de 800 personas infectándose con tuberculosis y más de 80 personas mueren todos los días en Latinoamérica. Es por ello pues, que nosotros creemos que la vacunación es una de las intervenciones más eficaces de salud pública y tenemos que apoyar eso. A través de la investigación y la innovación se han desarrollado nuevas plataformas tecnológicas de vacuna. Lo vimos con el COVID, pudimos solucionarlo. Con tuberculosis lo podemos hacer. De igual forma, nosotros queremos llamar a los tomadores de decisiones que inviertan y prioricen la asignación de recursos para finalizar estos estudios de eficacia y seguridad y acelerar su aprobación.
I'm sorry, can you try and wrap up because we have to be finished by 6 o'clock.
Si nosotros logramos aplicar estos estudios de vacuna, vamos a poder poner fin a la tuberculosis. Muchas gracias.
Muchas gracias. Now, I'll give the floor to each of our panelists in the order that they spoke to wrap up for us, please. Olga.
Today was one more important day for people who are fighting for their lives. We all together know what needs to be done. Let's make our response comprehensive and multisectoral. Let's do it because we know more time. Thank you all for all this day.
Okay.
I'd like to thank you for the opportunity and to insist when the 1 billion was done for the vaccine, we need to fix the price in advance. Because especially for the country that has universal health system as Brazil, and everything is free of charge, we have a huge responsibility with our people to buy this vaccine, and right now with a very high price for our country. So COVID vaccine was an example, and until now, when the market has a lot of profit with the vaccine, the price is still high. So we need to do this fixed price in advance when we fix the money for the vaccine. Thank you very much.
Thank you, Dr. Maciel. Dr. Hai.
Thank you for the opportunity to speak today and represent the young TB researcher. And to inspire young TB researchers, we need guidance from the seniors who can lit the fire of enthusiasm inside the youth, while supporting and empowering them as young leaders of the TB control efforts. And if we have enough funding to support and invest on TB R&D and the youth, TB will be no more, giving our next generation a future they deserve. Thank you so much.
Thank you, Dr. Hai. Dr. Turachi.
Today we have talked about the criticality of developing novel vaccines and what is needed for that funding, cutting-edge scientific research, frameworks, ecosystems. The ingredient at the core of all this, however, is partnerships, which I want to highlight with my final words. Thank you.
Thank you. Dr. Wandwalo, please.
Yeah, apart from increasing domestic and international funding, I think we should explore other innovative financing mechanism. Us from the Global Fund, we have been working with the World Bank to help countries to take loan, but also us as a Global Fund, we are buying the cost of that loan. So practically is a principal without that interest. So this is an option which countries can also consider. I think the other mechanism, representative from India talked about crowdfunding, which is in India, which is a very good model. I think countries should consider those kind of model, but also the cost of doing things. I think equipment, commodity are becoming very expensive. We should work together to shape the market and lower the price. Thanks.
Thank you to all of our panelists, to everybody who gave their interventions from the floor, and to remind you that if you didn't get a chance to speak, you can still upload your statements on Indico. And now I declare panel 2 closed.